All right, welcome everyone. We give everyone a moment or two to get in and get settled. I can see people joining here. We've got a big group with us today. We'll go ahead and get started in another moment here. All right, I think things are slowing down a bit. So I'm going to go ahead and get started with opening and some housekeeping. So hello everyone and welcome. I'm so glad you could join us for our webinar today. My name is Scott Johnson. I'm part of the team here at Blue Circle Health, and I've lived with type 1 diabetes for over 45 years. And I'm just thrilled to be alongside some very special guests for today's webinar about communicating with your healthcare team. Now, before we get going too far, I do need to cover some quick housekeeping items, and then we'll do some very brief introductions. So again, welcome, and we encourage you to use the chat feature along the way. I'll keep an eye on it throughout the session if you need anything during the presentation. And then just a few more notes that this session is being recorded. Participation in this event is completely voluntary and may reveal any identifying information that you share with other group members. So for example, comments in the chat. We're not providing any medical advice, individual or otherwise, and we may refer you back to your healthcare team for detailed and individualized care. And then finally, for anyone who's not familiar with Blue Circle Health, stick around until the end and I'll share a brief overview and answer any questions. So again, please feel free to drop those questions into the chat at any point and I will share those with the speakers as time allows. All right, thanks so much for your patience with all of that. Let's get started with some quick introductions. And first, I will hand it over to Dr. Laura Garelick. Thank you, Laura.
Thank you so much, Scott. My name's Dr. Laura Garelick, and I'm a family medicine physician and certified health and well-being coach. I've been living with type 1 diabetes for 37 years, and I'm delighted to have been invited to help facilitate our conversation today about communicating with our healthcare teams.
Great. Thank you so much. And I promise I'm going to get the pronunciation of your last name correct by the end of our hour together. Sherry, can I turn it over to you for introduction?
Hi, everyone. I'm Sherry, a dietitian, diabetes educator here at Blue Circle Health. I have been living with type 1 diabetes for almost 34 years now. But I'm so excited to be here and to talk with you and share my experiences as a healthcare provider and also to help you with your communication and talking with your providers locally.
Great. Thank you so much. Keisha, can I have you introduce yourself, please?
Good evening, everyone. Thanks, Scott. My name is Keisha, and I've been living with type 1 diabetes for 42 years now. I am a participant in Blue Circle Health, and I'm excited to be here with you all this evening.
We're thrilled to have you. Thanks so much for joining. And then Nancy, thank you for joining. I hear it's a very special day for you today. Can you tell us a little bit about yourself and what marks today for you?
Hi there, my name is Nancy Murphy. I'm from the Fort Lauderdale area, and today I am celebrating my 56th diaversary. And so I'm grateful to the whole community that we have here. And I was thrilled to go through the Blue Circle, gone full circle with the Blue Circle program. It's an amazing program, and I'm a huge advocate for it.
Thank you so much. And that's amazing. 56 years. That's wow. You are such an inspiration. And if my quick kind of back of the napkin math is correct, we've got well over 200 years of type 1 diabetes experience on the call with us today. So that is pretty amazing. Well, with that, why don't we go ahead and get started with the content? And Laura, I will turn it over to you to kind of get us going.
Thank you, Scott, and thank you all for being here. I'm going to make a very brief comment, and then we will help that lead us into our discussion. So, as members of the type 1 diabetes community, we all know that our healthcare system is both amazingly life saving and frustratingly imperfect. For the last 30 years, as a primary care physician, I have helped patients and families understand and use healthcare resources, sometimes in the face of significant systems challenges. I also direct a peer support program for clinicians and hospital staff to help them when they experience particularly stressful circumstances. That communication is so important for everyone's health and well being, and it is not always easy. I've also learned that one of the best ways for us to cope with complex issues and questions that have multiple answers is to talk about our experiences in the setting of a judgment free zone, like we are going to do during this session. I am grateful for the courage of our panelists in sharing their perspectives so that we can all learn and grow together. I also thank those who are joining us live online or watching the video. If you're joining live, we welcome your comments and questions in the chat. And thanks so much to Scott for keeping an eye on those and bringing them into our conversation when possible. So, that being said, let's get started with our panel discussion. And I'd like to start with a warm up question for everyone who is on screen today. And the question is, in what state do you reside? And what is one thing that you really like about living in your state at this time of year? I'll go ahead and start. I live in Massachusetts, and it is quite cold at this time of year, which is the beginning of December. And I love coming in from the cold and having hot soup. And now I'm going to pass it over to whoever would like to do the warm up question next. What state you live in and what's something you really like?
Yeah, let's go with Sherry next.
All right. So I am in Western New York, near Niagara Falls, and it's cold. Um, but what I really do like to do during this time of year is actually go to the falls and just see, you can see how the mist will freeze, and it's just magical. It's really pretty to see. So that's one of the things I enjoy doing here this time of year.
Sherry, tell me quick, what does that look like? Like, is it just kind of glistening in the air, the mist when it's freezing, or how does that work?
It does. It like glistens, and then it lines all of the branches of the trees that are nearby, and so they just kind of have this little sparkle to them. It's just really neat.
Yeah, that sounds amazing. Keisha, how about you? Will you go next?
Sure. I live in Delaware. It's cold here. What I like best about Delaware is we're close to beaches. We have 60 miles worth of beaches here. So there's always fun things to do, whether it's summer or spring. In the winter, you can find places where you can ice skate. In the summer, you can definitely just enjoy the beach area.
That sounds amazing. Nancy, how about you?
Well, I'm in Florida and we are having unseasonably warm weather here this week. So it's been in the high 70s and low 80s. So it's beautiful. It's warm. I get cold very easily, so I'm so glad to be here. Every now and then we have a cold day and it lasts about a day and then it warms right up. So it's just great here in Florida.
Thank you. And I'll round out our warm weather group. I am joining from sunny San Diego, California, where it is currently 71 degrees. I grew up in Minneapolis, and so I'm no stranger to cold weather, and I'm very spoiled. I like living in this warm climate. So, um, there's nothing like playing outdoor basketball around Christmas time. It's pretty magical to me. So that's one of my favorite things. But great question. Let's keep it going.
Well, now I want to go visit all of you, each one. But I am really excited about having this virtual conversation as well. So what we're going to do is I'm going to ask some questions of each of our full circle panelists. I'm going to ask several questions in a row of one person, and then we'll switch to the other person, and then we'll bring in Sherry's Blue Circle Health clinician perspective. However, as we go along, if somebody wants to make a comment or add something, especially Scott, please jump in. And then we will have a more open discussion as we move through our conversation. So I didn't get a chance to ask Nancy and Keisha who wanted to go first. So please volunteer, or Scott, maybe you can help us with that.
Yeah, that sounds good. I'm gonna, Keisha, you're first on my screen, so you get the lucky first slot.
Okay.
So Keisha,
And
it's
alphabetically too.
you. Really a pleasure to meet you, and thank you so much for having this conversation today.
You're welcome.
So I'm just wondering, since we haven't met before, what brought you to Blue Circle Health?
What brought me to Blue Circle Health is I was on Instagram and an advertisement popped up and I'm like, can't be true. Um, it's actually, I can talk to an endocrinologist who can actually be a type 1 diabetic, a whole team of individuals who are familiar with what a type 1 diabetic is. So I Google searched, I did my own research, and then I signed up and I got a call right away. My main point of joining Blue Circle Health was pretty much just trying to get a better understanding of more education of new technology. I do use a CGM and an insulin pump, and the things change over the years. So just wanted to know what was out there. And I also wanted to get more information about the nutrition part and this education. I always like to, I think as a diabetic, it's important that we stay educated on all the different opportunities and all the different things that we have available to us now that was not there 42 years ago.
So it sounds like you were really interested in experts in type 1 diabetes, even people who lived with it themselves, and you wanted a boost to your knowledge around technology, nutrition, just overall education, a real boost to your own self-care. So that sounds
That is.
excellent. Yeah. So which services did you take advantage of during your time with the program?
The services that I took advantage of, I had an endocrinologist that I worked with, which was great because it was very knowledgeable. I learned so much. I learned how to read all of the different my CGM settings, all the different graphs, what they meant, just a whole education behind it. And I also spoke with a dietitian and an educator. So it was just awesome to be able to have those individuals who understood uh, what I was talking about, how I felt, because they could relate.
Wow, that really does sound excellent. And
Mhm.
I'm just wondering, the program is 6 months. So during those 6 months and, before and after, I'm wondering who is on your ongoing healthcare team?
I have a good endocrinologist that I've been working with for many years here in Delaware, a nurse educator, but they're not accessible all the time. It's usually I rotate between 6 months. I might see my endocrinologist, and then the next time I might see the nurse practitioner. So it was good just to be able to have that ongoing conversations on a monthly basis when I was going through Blue Circle as a participant.
So I think you started to answer my next question, which was how did your communication with your Blue Circle team compare to your communication with your ongoing healthcare team?
It was more it was heartfelt. I had a whole hour. I didn't feel rushed. Sometimes when you go to a doctor's appointment, you may feel a little rushed. I had an entire hour where the time was just dedicated to any questions I had, what problems I may be occurring, and just it was a safe, open conversation. I could talk about low blood sugars. If my CGM or my insulin pump is beeping. They know exactly what was going on. It's like, take your time, treat a low blood sugar if I was experiencing it. It was just an overall great experience.
Yeah, that sounds like it makes such a difference to feel like you're really being listened to, that you really have time, and that you really have the expertise that you're looking for. So I'm wondering what you feel you've learned from the Blue Circle program about communicating with your healthcare team that you wish to bring to your ongoing team, or maybe it's already there in your ongoing team and you wish to continue.
Mhm. I was actually able to, when I go to my visits now and I understand what the graphs talk about, I understand what I need to do to make sure my A1C is below. I can say when I was a part of the Blue Health Circle as a participant, my A1C dropped by 1 point. I think when I last left, I was at 6.5, which was amazing. And that's just because the constant education that I was getting. So I come prepared to my appointments. I ask questions. I keep a list with me when I go to my appointments so that every minute is being used, a question is on that I have. I feel like I'm more of an advocate because I have a better understanding of what it is that makes me a better, just so I can avoid any complications in the future and actually have an educated conversation with my endocrinologist and really know what I'm talking about.
So it sounds like your experience with Blue Circle really empowered you to prepare for your visits and to advocate for yourself during your visits with your ongoing team. Is that right?
That is correct, yes.
Great. So we're going to circle back again, but I would love
Okay.
to talk with Nancy about these same topics. And that's just really inspiring to hear that part of your story so far.
Thank you.
Hi, Nancy.
Hello. Hi there.
Congratulations on celebrating your day, and thank you for celebrating it with us.
Thank you. It's a joy to be here.
So,
Thank you.
you've heard the questions I'm going to ask, but I will repeat
Yes.
them.
Okay.
So it is such a pleasure to meet you, and please tell me what brought you to Blue Circle Health.
Sure. I actually heard about the program at first directly from Scott, because Scott and I go way back from the diabetes community for many years, and he told me about the program. And I just thought it was amazing that, wow, Florida's the first state, and I was thrilled. And I had also heard of the Helmsley Trust in the past from a clinical trial that my daughter was in. She's also a type 1. So she was in a trial years and years ago, and it was funded by them. So just like Keisha said, also it's like it sounded too good to be true, and that it's at no cost. And I did not have insurance at the time, so the first thing that I came in seeking was assistance with finding an insurance plan. And I worked with someone named Rosa, and she was amazing, absolutely amazing. And she helped me find insurance, and I have insurance now. And so uh, I'm just thrilled. So
Wow, that really makes a huge difference. So,
yeah.
I'm so excited that Blue Circle started in Florida, and that you were aware of it and able to take advantage of that. Were there other services that you took advantage of during the program?
I did. When Dr. Ko was my doctor while I was in the program, and not having had insurance for a period of time, um, I hadn't seen my endocrinologist for a while, so getting new prescriptions, and Dr. Ko also helped me transition between the G6. Not just Dr. Ko, but the other people, the tech experts and so forth, helped me transition between G6 and G7. So that was a great thing. And I use the Omnipod, so she just really helped me with getting my settings in a good place. And I have a history of having, as long as I've had type 1, I've had some very severe lows. So she helped me kind of not have any more lows, like to the point of having seizures and so forth. So I really haven't had any since I saw Dr. Ko. She's been great in helping me that way.
Wow. That is just wonderful to hear that
Yeah.
that change happened for you, that really positive change.
Yeah.
Um,
Yeah.
so obviously with the health insurance issue, you may not have even had access to an ongoing healthcare team before doing Blue Circle, but I'm wondering, do
Right.
you have an healthcare team now?
I do. I do. And I did have a healthcare team. I just didn't have insurance to go see them. It was kind of just limited my ability to go have an office visit or whatever, or have you. And even writing prescriptions, well, they would say, well, we haven't seen you in 6 months. So, um, we're not giving you prescriptions right now. So luckily I was able to get updated prescriptions through Blue Circle, and that was very helpful.
Oh, yeah, definitely. Gosh, that's so frustrating when you can't get your prescriptions. That's awful.
Right.
Um,
Right.
yeah, so really positive changes. Um, I'm
Yeah.
wondering if you could tell me if there are any differences between your communication with your Blue Circle team and your ongoing healthcare team now or before. Obviously, there was difficulties with communication before. So,
Right. Right. I mean, Dr. Ko is amazing. And if I have a question, I can just send it along, and I get answers very quickly, much quicker than I would get through my healthcare system, through my chart. I put in a note in my chart before Thanksgiving, and I still haven't heard back. I was actually asking about the National Park Pass, and so I asked them if they could write a letter for me. I still haven't heard back from them. But just little things like that. They're busy, and my primary endocrinologist is moving towards retirement, so his accessibility is much less. Now, I know Blue Circle is a temporary thing, but it's been extraordinarily helpful. And I wish the regular providers had more time in their days, and they're bombarded with patients also. But it's just amazing how responsive Blue Circle is to patients and questions and assistance. And I didn't just meet with Dr. Ko and with Rosa. I got to meet with everybody at least once. And I also love the little classes and the support group and the cooking. Rita's cooking is amazing. And so there's like so many aspects of this program that are just so valuable.
yeah. And I haven't done the program, but like Rita's cooking classes and, basically even people who aren't part of the program can access some of these really wonderful resources.
Yeah.
So I'm wondering if you feel like there are aspects of communication with your Blue Circle Health team that you would like to bring to your ongoing team or that you already have and would continue with your ongoing team, things that are working with the ongoing team that you have now.
Well, little things like I keep notes in my phone. So on the day of my appointment, like it could be weeks in advance, but I'll put all my questions into my appointment that day in my own phone, or a list of my insulin and my pump settings and so forth. I keep all that stuff in my phone so it's readily accessible. And I do that with both teams actually. It's just something just to be prepared and aware, and if I think of a question just in the middle of the night, I can just add it to my phone and I've got it there, and that's always helpful. I love the ability to text with Blue Circle because I really can't do that with my provider. So that's kind of a bonus thing, I guess, with Blue Circle that I appreciate.
Yeah, yeah. I mean, that sort of clear and direct and timely communication makes such a difference. But the work that you're doing of keeping track of the details for yourself really also helps. I was talking with Scott the other day about how challenging it can sometimes be to keep track of all our settings. So I
Right.
really admire that you're doing that. So that's great. So
Yeah.
I want to bring in Sherry's perspective now. As I said, we're going to circle back again, But thank you, Nancy, for all the insight and that excellent tip about keeping information right there at your phone fingertips. That's a great tip for everybody. So why don't we move along to Sherry and ask her a few questions? Hi, Sherry.
Sounds good. Hi.
Okay. So your questions are going to be a little different because your role is a little different. So I'm wondering, when meeting a new Blue Circle Health patient, what are some common communication barriers that you notice?
So a lot of times patients will start to say that they've done something really bad or they ate food that was really bad. There often will be negative or fearful that I'm going to judge them. So there's that barrier there. So I always try to put people at ease, and tell them that, if they enjoy food, it's not bad. So those are some of the big barriers I think that people come to us with, is that they have had a lot of judgment or just negative comments towards them, whether it's from providers or other people. And so I feel like I have to try and remove those by letting our patients know that they're in a safe place to be honest and to talk about things, and that they're not going to be criticized if they enjoy a piece of cake for their birthday.
Yes. So it's really important to have a judgment-free zone.
Yes, very important.
So that people can learn. And I mean, that's as a primary care physician, but somebody who's also trained as a health and well-being coach, that is sort of this cultural divide that I see, that in healthcare, sort of traditionally, I think a lot of us feel like we're being judged, and that isn't always that helpful. So thank you for bringing that up and identifying that. Are there other barriers that you think are important to acknowledge in communication?
Yeah, I really try and acknowledge what they already know, and kind of build on that and ask them about their experiences that they have had, um, just to kind of, I don't know, maybe help patients feel that their experiences have mattered and are important, and it builds who they are, and then how we can, encourage or build from those experiences to help patients feel more confident and more empowered as they manage diabetes, and hopefully feel confident when they finish to be able to have conversations with their providers.
Yes, I totally agree with you. And, as a physician, I am so grateful for patients being honest with me and sharing with me what's most important to them to address, um, even though they might hold back and often not say things because they think I don't have the time, or various reasons. So I'm so glad to hear that you're helping people in that area. Um, and also, I was wondering if, um, do you invest in building skills to equip your patients for improved communication with their ongoing healthcare teams? And if so, how?
Yeah, so one of the things that I like to do with patients is kind of talk about some of the challenges they're facing, and then we kind of approach it and how they might ask their provider, like walking through scenarios or maybe role playing. Um, Not like majorly role playing, but like, hey, maybe this is what you can ask, and maybe approach it from this point of view, so they feel more confident, and that they've already kind of rehearsed what they want to talk with their provider about, and giving them some tools or maybe the vocabulary or the words to say that they may not know how to express otherwise.
Yes. I think that for any of us, practicing a conversation ahead of time feels a little awkward, but it's so helpful. And it might not be that we don't know the words. It's just that we need sort of that space and time to think about how we want to say something. But in this particular setting, it might be a specific word. And having somebody to role play with, even if it's not a clinician, can be really helpful. Like somebody you trust to say, hey, I'm going to go to this appointment and I want to get to these issues. Can I practice a little bit? So that's one of the tips. Some tips are sort of emerging out of our conversation. So I did want to ask you, Sherry, and then kind of open it up to the rest of us. Are there other communication tips that are easy to remember in the heat of the moment that you would recommend?
And Nancy mentioned it too, like how she likes to make a list of questions. I think that's really important, and prioritizing your questions and your time with your provider. I think that that's a really good tip. And also just not being afraid to approach a topic that you may feel nervous to approach. Maybe talking about a different pump or a different CGM, or whatever the topic may be, or changing insulin doses and that sort of thing, and encouraging patients to not feel that they don't deserve to have that conversation with their providers. But making the list, I think, is very important.
I totally agree with you. And I think that the providers actually really appreciate that. As it's funny because I'm sort of on both sides of the fence, as are you, Sherry. And I think that from the provider side, there are a lot of barriers that are systems related in terms of how people have to practice and how they have to offer care. But when the patients or the families show up with their true selves and true concerns and share their priorities, especially if they've done some homework ahead of time to have a list, it's just wonderful. It's not shameful. They're not taking advantage of the provider. They're helping the provider. So that's what I see.
So one other tip on that, like making that list, is taking advantage of that portal, and maybe saying, hey, doctor, I would really like to talk about X, Y, and Z at my upcoming appointment. So then the provider may then be prepared as well to know what resources they may have. So they're not then trying to think about things off the fly or something like that. So that may be helpful as well, to take advantage of that portal system.
Yes, definitely. And also, I think that providers like it when you come in with something in writing. Like, you may even want to print out the list on your phone if you don't have the opportunity to send it in a portal message ahead of time. Or, I've had patients come in to me with long descriptions of things, and I might not always use everything in their documentation, but it's just so helpful. It's like starting ahead of the game. So,
Yeah.
And sometimes I think patients feel like that would be too much to offer to somebody, but I don't think it is.
Agree. I don't
So I have
either.
Yeah. So other tips that you have, Sherry, before I sort of throw a question out to the group as a whole?
I think too, for our patients to hopefully feel confident when they go in to see their doctor and not feel like they are always doing something wrong. So hopefully we've been able to empower our patients to where they feel more confident in talking to their providers. And then I just think that helps appointments go smoother as well.
Yes, definitely. I think that both, running this support group that I run, I think that both the staff, the clinicians, and the patients and families, I think everybody really wants people to be well, and knows inside that we're all human. However, there is a system that we have to function within that doesn't always honor that for a variety of reasons that don't always make sense. So I wanted to throw out the question to our whole panel here about that. What do you think it is about circumstances or about our healthcare system that creates barriers to communication?
What a great question. I'll start and buy you all some time to think. I think it's just there's so much time pressure, and when I think about it's coming from both sides, right? So me as someone living with diabetes, when I need to actually go in for a physical office visit, it's usually a minimum of 3 hours that I need to take off time from work, and I'm taking time off work, I'm driving to the appointment, I might have to pay for parking, and then I'm paying for a copay, and then I'm, like, rushing to get there, and then I sit inside the doctor's office because, maybe they're running a little bit behind, and then I have a what feels like a very short amount of time with the with my provider, my healthcare professional, and then you reverse it all back, right? I leave the parking lot and I drive back home, and it's often good. It's just also a lot. And so when I can contrast that with the value that I feel like I get in most cases a very similar level of care and value when I'm able to do my appointments virtually and remotely, with the exception of um, my some things that I can't do virtually, right? So I go in once or twice a year to make sure that my diabetes specialist can physically take a look at my feet, or that I'm going in for my annual dilated eye exam. Those are things that can't be done virtually yet. Um, but it's definitely, I think, one of the biggest constraints in the when thinking from a systems-based standpoint. It's the it's the time. Keisha, how about I throw it over to you next?
I would agree with you, Scott. I think one of the biggest with communication is sometimes we get comfortable. We get so used to the norm. I know, speaking for myself, over the years, it was always the same type of visit. Now, when I come in with questions, so when I leave the visit, I feel a little more empowered. I feel like I have control. I feel that my voice is heard, because it's just not, let's go over numbers. I usually know what my A1C is before I go to the doctor, what my cholesterol counts are, kidney functions. I always try to look at that information before I go, so that the visit is truly where we can sit and communicate about what the next steps are, or what I can do better, um, and what my doctor can actually do better to support me.
Do you make a point to make sure you request or get your lab orders in before going to your appointment? I've had mixed experiences where sometimes we're able to coordinate and get that done, and that seems to enable a much more detailed discussion about my results versus other times when I haven't been able to coordinate or get my schedule together enough. We talk about what labs the doctor wants to order at my appointment, and then it's followed up after the fact. What's that been like for you?
Yes, I'm able to get my labs. I usually see them once they go to the doctor. I get an email that they're ready to be reviewed on my end, so I am aware of what they are. Some blood types and things I'm not familiar with, so I will make questions around those, and then it gives me a history as well, so I can see if it's improved or if I need some work.
Yeah, that's great. Nancy, what about you in terms of the system issues that you might face when you're dealing with your healthcare professionals?
Sure. Just one note on the lab. I found recently my doctor had put the lab orders in advance, and I went online and I made an appointment with Quest, and I showed up for my appointment. I got a text that said, "When you get here, check in, press this button and check in," on my phone. When I went inside, I did not have to check in again, and I was seen within 5 minutes. It was the fastest experience I've ever had in the lab setting, but the doctor did call it in advance. My primary also ordered some things, and it was all right there in their system, and they did everything at once, and making the appointment in advance was a huge time saver. I've never gotten out of the lab in less than, an hour, 2 hours, sometimes 3 hours. It's always just kind of crazy at the lab. My big thing, I've talked about this before, is the whole prior authorization process. And I don't understand, why do we need a referral? If we're a type 1 diabetic, why do I need a referral to my ophthalmologist for my retinal eye exam? Or why do I, need a repeat prescriptions and pre-authorization? It's like, once you get the pre-authorization, it should be more than just 90 days. It's like, unless there's a cure for diabetes right out there tomorrow, it's like, I'm going to need my supplies no matter what. I'm going to need my insulin. I'm going to need everything. And so I wish there weren't so many blockages and obstacles related to those things.
Yeah, absolutely. Laura, what comes next?
Well, I just want to say that a couple of things, some great wins here. Like, I love hearing that story about going to the lab. And again, we can ask our doctors to order the labs early. Now, it won't always work, but if we put that out there as a request and expectation, it's often welcome. We might not think it is, but it is. And then, the other thing too is that with a lot of these barriers, the clinicians and their teams feel the pain along with us. The prior authorizations, I mean, there's been a lot of advocacy at the, sort of higher levels to try to streamline that or get rid of prior authorizations, at least in the state of Massachusetts. And I would encourage everybody to advocate for that. So it's really great, though, to hear some of these wins and some of the ways in which, in spite of some of these barriers, we can make individual progress. And as a group of people, we can advocate for systems that make more sense for everybody. In terms of other questions, I'm wondering if there's anything that you think would help with your communication with your ongoing team, which I think we all have on the panel, that you haven't tried yet, that you might like to try, that you might have heard about during our discussion, or something else you've been thinking about?
It's a great question. I'll buy the group some time again and go first. I I try to make a list of things on my phone. I have to admit that I'm not very organized with that list. And so instead of having one list that has several questions that I think of, I end up with 5 or 6 different lists or different notes all over. And I have to be really on top of my game to have time to go back and pull them all together and get my thoughts together before going into the appointment. And so something that I'm going to try and do is be a little more organized leading up to my appointment. Maybe what I can do is even set a calendar reminder for myself to just take, it probably wouldn't even take 10 minutes if I just sat down and did it, but to take that time and do that before um, going in for my visit. I also want to make a point of requesting my lab work to be done, and then I can make that, just make that stop a few days beforehand. So, Nancy, what about you? I'm going to come to you first for this one.
Um, I feel like I've been doing this so long. It's like, what else can I do? It's just um, I'm not sure. I'm not sure. I'm not. Yeah. I don't know. I'm sorry.
That's okay. Nothing to apologize for. Keisha, any thoughts from your side on that?
I'm sorry. I just want to say I should have phrased the question also, if you don't want to do something new, what's something that's working for you that you'd like to continue?
That makes sense. As far as like making my notes, my like Scott mentioned, having multiple different notes, and every now and then I do that as well. I have notes all over the place, but by having it right there in my appointment on my phone, and I know I have an appointment that day, I can just put all my stuff in there, all my questions, all my everything. It's That's really helpful. Um, so that's something that I'll continue doing, and requesting the labs in advance and scheduling the lab appointment. And so I mean, those things that I've already mentioned are pretty helpful. Pharmacy is an important thing, because now a lot of our our supplies and so forth are pharmaceutical. So just keeping in touch with the pharmacy and making sure they understand, and going online to their website, I find that that helps also. And when it comes time to renew, that's another thing. I might put a note on my calendar. My renewal's coming up in a few days. I always try to renew things early so I can stockpile a little bit. I'm a big advocate of stockpiling when it comes to our diabetes supplies, because you never know if there's any issues or something fails, or you need a backup, what have you. And so I order everything early, as early as humanly possible, to make sure I have extra. So
So they're great ideas. I love the idea of using the calendar entry as a place to keep your list. That's very smart. Something that I can do. I can make that change right away, Nancy. So thank you. Keisha, how about you? Is there anything any ideas that maybe you've learned from today's talk, or things that are working well for you that you want to continue bringing into your appointments?
What's been working well with me, and I learned this from Dr. Cole and Sherry, is making sure that, as an insulin pump user, I never really thought about having insulin pens in case it stops working. So I'll always make sure that I have insulin pens with the short term and the long term acting insulin in case it stops working. I also, they encourage me to make sure that I have a hypo pen. So I have the Gvoke. Always make sure that prescription is still good. And I always have two one in my car, and always one in the house just in case. And just making sure that I have test strips, because sometimes we rely on our CGMs and they may need to be calibrated because we're getting a lot of errors. So those are some of the things that I've learned, and I'm continue to talk about when I do go to my visits.
I love that. And in fact, those are two things that I have on my list too. I have glucagon. I've got the Baqsimi, which is the nasal spray, but it's
Yes.
expired, so I need to get a new prescription for that. And then likewise, I also have several backup pens, but they've been around for a long time, and yeah, I'm probably overdue to renew those. Sherry, what about you in terms of this question? What are things that you've learned, or that you want to continue doing with your personal healthcare professional?
Yeah. So, in my time of having diabetes, my family has had to move a lot, and so I always try and keep a list of all of the providers I've seen for my diabetes management in case I have to request extra records. So that's one thing that I do, is I have that. But I have to jump on the bandwagon with the doing labs early. I actually go tomorrow to see my endo, and did the whole quest thing for my labs last week. But I also need to ask for new glucagon and new backup insulin. So it is definitely remembering to do those things that we just don't ever use, and keeping those up to date. But yeah, so doing labs early, keeping backup, or keeping a list of all the providers in case I have to fill out stuff if they want information from previous endos that I've seen in the past.
Yeah, those are great. I do want to also share a comment from Dr. Gomberg in the chat. She is offering an insight for those who get the labs done afterwards, and that there can be some benefit to that too, in that It's possible that after some discussion, your doctor may, that discussion may surface needs or a desire for additional lab tests. And that's, I think, always going to be the case. And thank goodness that happens. But if you do your labs afterwards, you may not have to go twice. And so I think all of us kind of have to balance the convenience factor of going ahead of time versus not having to go a second time if something else comes up. So that's a great point.
So if you time your blood draw within a few days of your appointment, sometimes they can add the labs and not have you drawn again. So it can be tricky, but that can be done as well.
That's a great tip. I love that tip. All right, just doing a quick time check. We've got about 10 minutes left, so I'm going to let you keep on rolling.
Oh, well, I haven't said my thing that I'm going to do. I love putting the notes on the visit appointment in your calendar. That's great. I went to my endocrinologist recently and I had notes and I forgot to look at them and I forgot to ask something that I wanted to ask. It wasn't crucial, but I'm going to put it now right on that appointment date. So thanks for that tip.
Yeah, such a good one, right?
Yeah. All right. So I think we have covered a lot of the things that I had wanted to ask about. I'm wondering, Scott, was there anybody who put in any questions or comments in the chat other than Dr. Gomber?
Not yet. No, we don't have. We've had some comments about lucky draw with getting a park pass by being able to just and sometimes you can just ask the ranger that's at the station when you're coming in, and I think it depends a lot on kind of that particular park and the ranger who's on duty, but we had one lucky participant able to get their park pass right on the spot, which is amazing. And then the comment from Dr. Gomberg about the labs, and then a comment about a good refresher using insulin pens if our diabetes tech drops in the toilet. And I am guilty of dropping many of phones in the toilet. I haven't dropped my insulin pump, but yeah, so definitely a good refresher, because it's one thing to have the backup pens. It's a whole nother thing to know how to use them. So yeah.
Can I just mention about the national park? I was just going to mention because I did finally get the park pass and also for my daughter. But what they did, they asked for a letter, and the documentation, it's nicely written. I'm trying to see if I have it near me, but they mentioned because diabetes is considered a permanent disability, even though you're not fully disabled, but your pancreas is dysfunctional. And so it mentions that because that is a permanent disability, you can get the pass for life for free. And so that was a big advantage. And I showed them the letter at the park. I found the nearest park to me and I went there and they gave me the pass. So that was very nice. And the language, there's like prescribed language. I can share it with Scott. I don't know if any endocrinologist might have this language. I'm not sure, but it's really nice, and it's a nice opportunity if you want to go visit national parks and not have to pay fees.
Yeah, that's a great point, Nancy. And I also recently just got mine. I used the mail, so I ordered it from the park systems over the mail. And send me the letter your doctor wrote. And between your letter and my letter and our Blue Circle Health team members, I bet we could put together a pretty good sample letter and get it on our website for people who may be interested. So that's a great tip coming out of this. Laura, any other questions that we want to talk through? We've got about 5, 6.
I have another group question.
Let's do it. I love it.
Is regarding communication with our ongoing teams. Is there anything different about the way we communicate with our diabetes specialist or diabetes specialty team members versus our other healthcare team members?
Yeah, that's a great question. Keisha, can I come to you first for that one?
Absolutely. Um, I find it sometimes a little more difficult to communicate with my other healthcare providers who aren't on like my endocrinologist team, just trying to explain the difference between type 1 and type 2. That can sometimes be frustrating because there's certain tests, for example, when I go to get my eyes, it's like, well, we're going to test for this, but this test is for type 2. I'm like, well, I'm a type 1 diabetic. And then I find myself needing to explain. I don't find that much with my podiatrist, but with the dentist, and sometimes you got to let them know the difference between type 1 and 2.
Yeah, and that
That
can
can
be
be frustrating.
frustrating. Yeah, yeah,
Mhm.
we said it at the same time. It can be frustrating because we almost, I think, have this expectation, perhaps unfairly, that these people who are not diabetes specialists, we almost expect them to have at least a level of awareness of the differences and the subtleties. I also am thinking in my head about how I cringe when, maybe I've worked really, really hard to get my A1C down to maybe a low 7 point something, and we go into a non-diabetes specialist, and they say, "Ooh, that's still above target. You got to work to get that down." And I'm like, "Brother, if you had any idea how hard I have worked to get that where it is." Nancy, any thoughts from your side on that question?
I think it's important that as patients with years of experience with diabetes and using all the different technologies, when a person goes to medical school or nursing school, I'm a registered nurse also, um, they don't learn all the little details that we know that we deal with every day. I mean, your CDE might know all the details about your pump, but and this is another thing with school nurses, for example. You always hear like, "Oh my goodness, my school nurse doesn't know anything about my pump, and how could that be? What they don't know about diabetes?" And it's like they learn a lot. They're learning about every single body system, and there's a lot of diseases out there. So they may not know all the nuances that we might know. And there are experts at these things, but we have to be reasonable too and help them, like educate them a little bit. I've seen providers who maybe have never seen, a particular thing or a pump or, the nurse in the office or the different people. So we have to be, take the initiative to educate them because they don't know everything. And I mean, nobody knows everything, but there's so many diagnoses and so many conditions and so many body parts and all that. So there's a lot out there. So we just have to be understanding and educate.
It's a really great, it's a very great and kind perspective, Nancy. I think that serves you well. Can I jump in with a question from the audience before we move on? We've got a great question about um, any thoughts or recommendations about um, handling and coordinating communication between specialists or between doctors' offices. I know I often feel that burden falls on me, and I feel it unfairly falls on me. It's like, come on, you guys are, you folks are doctors. Can't you talk to each other? How does how does that play out in each of your lives? Keisha, do you have any experience there that you want to share?
I do. I normally ask whenever I see a specialist that they communicate with my primary care doctor and my endocrinologist, whether or not the documents and the notes are normally forwarded to them, and then I'll have a discussion with them when I do visit. Another thing I wanted to say, even here at Blue Circle Health, every time I visited with Dr. Cole or Sherry, those notes were forwarded to my endocrinologist and we talked about them. So that is another perk that I wanted to let everyone know who's listening, that all the communication is not, you all communicate with the doctors as well.
That's amazing. Nancy, is there anything you'd like to add on that?
No, no, I agree with you, Scott, that I think I feel like it's my responsibility because they're so busy and they have so many patients. And meanwhile, I'm the central thing in knowing about my healthcare. So I feel it's my responsibility to communicate what's going on with my other providers, if I have other providers, to let them know. Because I'm the centralized database of all the information of what's going on with my healthcare. And they may not have time to go and look at the my chart or the whatever. So I take that on myself.
Yeah, that's great. Well, as we reach the top of the hour, Dr. Garelick, is there anything that you'd like to um, ask our panelists in terms of closing questions? Any specific angle on that?
Um, I would just like all of us to have a chance to have sort of a parting um, piece of wisdom that they've either drawn from this conversation or just in general to share with somebody who might be in the audience. I can start with that if you'd like. Hmm?
Yeah, go for it.
Okay. Okay. So I would say trust yourself or trust yourselves and know that you're not alone. I love how Nancy talked about educating or sharing information with somebody or with a team member who's trying to take care of us. Um, we really have a lot of knowledge. We are the experts on ourselves and our own health and well-being. And it's okay and preferred to ask for help with that, to share what we value, because that helps our village to serve us. And it's, even though the system isn't perfect, it is really appreciated, not resented, when we clearly ask for what we need.
It's great. Thank you. Sherry, how about you?
I would encourage people to be confident in what they know about their diabetes. If they know that something, impacts them differently, don't be afraid to share that. And, continue to keep your list and have that available when you go see your provider. But yeah, I think just being confident, knowing that you know yourself the best and that it's okay if you have questions and encourage you to ask your provider as many as you can as time allows for.
That's great. Thank you. Keisha, any closing thoughts from you?
I wanted to say just to keep the confidence. It's okay for days when you're frustrated and when it's okay to say that you're not okay because we go through so much in a day. Just stay motivated. We're all warriors here. We'll get through it together. And just reach out to family and friends for support and just know that it's so much technology now. So when I was diagnosed, I was told I wouldn't be here until I was like 21. It was just that was back in the 80s. So much has changed. So just keep doing the best that you can do. And it's okay to say that you're not okay on those days that you're not.
Very well said. And even after all these years, we all have those days where, where we're just trying to make it through to the next hour and be okay. Nancy, our special 56-year diversity honored special guest, what are your closing thoughts for
Thank
today?
you. Oh, I agree with what the other panelists have said and just, keep track of your notes. Be kind to your providers. Always use the opportunity to educate and advocate. I'm a big fan of advocacy anyway. And even if it's something related to your healthcare with your providers or reaching out to a congressperson or whatever, to let people know what we need and what's important to us. And don't stress over your number at that moment and so forth. I always hear people worry about the numbers. Don't worry about the numbers. It's a point in time. And so, yeah.
I love that. Thank you. Well, Keisha, Nancy, Sherry, thank you so much. And Dr. Gorelick, thank you for spearheading this engaging topic. I think it's really well received and well badly needed and a topic that we could continue to talk about for much longer time than what we've got available here. So just thank you all so much for your time and expertise. You're welcome to drop off anytime as I do some closing housekeeping or stay along for as long as you like. And I also recognize folks that we're a little bit past the hour. Just really appreciate everyone who joined today. I hope that you're leaving with a sense of maybe some validation, some practical takeaways, and hopefully a feeling of optimism about communicating with your healthcare team. I'll be sending a follow-up email with the recording, some resources, and links that you can so you can review any of the information today. It'll probably take me 2 or 3 days to get that together and get that sent out. And then remember to check out our website events page to stay up to date on future Blue Circle Health events. You can find that at bluecirclehealth.org/events. The next event is our Spanish language group session this Thursday evening. And then we have a couple of podcast episodes scheduled for release before the end of the year. So that's another way to stay connected through the holidays. And then we're already into January, if you can believe it. So you can find information about the podcast along with links to recent episodes under the news section of our website. Again, that's bluecirclehealth.org. So you can find the events under the events heading in the menu, and then the podcast is under news. And then finally, for anyone here today who may not be familiar with Blue Circle Health, stick around. I'm going to share a quick 5-minute overview, and then I'll be around to answer questions. So let me get the slides going here. And as I get the slides going, please share any questions that you have along the way in the chat, and then I'll go through them at the end. And again, this really should only take a couple of minutes. So, one of our core beliefs here at Blue Circle Health is that people with type 1 diabetes shouldn't have to fight for what they need to live. So, Blue Circle Health created a free 6-month virtual clinical care, education, and support program for adults with type 1 diabetes. So, you can focus on living, not just surviving. Our mission is to learn the best ways to care for people with type 1 diabetes, apply those learnings to care for as many as possible, and then share those learnings to improve type 1 diabetes care everywhere. Blue Circle Health is made possible thanks to generous funding from the Helmsley Charitable Trust. So, what exactly does a program like this mean? So, we offer a free, flexible program to extend care between your visits. Our program is up to 6 months long. It's done entirely virtually over Zoom, text, and phone. As mentioned during the call today, you stay connected to your medical homes and we send regular updates to them. Our services are free regardless of insurance and immigration status. Re-enrollment is possible 1 year from the original enrollment date. And the program offers as much or as little support as requested. So that means you can take advantage of every service that we offer or pick just the ones that you need. And that can change throughout the time in your program too. So the graphic on the right side of this screen shows our available services, and I'll do a quick description of them in a little more detail, going counterclockwise and starting with clinical care. So, clinical care is exactly what it sounds like. It's visits with an endocrinologist or an advanced nurse practitioner. Insurance navigation is consultation with insurance specialists who can help you understand and maximize any insurance coverage you might have. They can help you find insurance coverage if needed, and they can also help with prior authorizations. And as again mentioned during the call today, prior authorizations, it's definitely, they play a primary role in my diabetes care, and I bet many of yours as well. Diabetes supportive counseling that offers help with the emotional burden of T1D. We have a team of case managers who can help if you're struggling with food, housing, or employment insecurities. And then our peer support and community. So, in addition to the monthly group sessions, like I mentioned in the upcoming events, those group sessions are available for current and past Blue Circle Health program participants. And everyone who enrolls also gets a dedicated T1D support guide to work with, and they'll help you navigate all of the other services And they're also just there for you if you need someone to talk with. And then we have ongoing community events just like this and connections to other great type 1 diabetes community organizations. Next up is education and nutrition. So these are visits with registered dietitians and certified diabetes care and education specialists. Then there are two additional programs available within the Blue Circle Health program. The first is a prescription assistance program for qualified applicants who need help paying for supplies and medications. The qualification for that program is an income level at or below 300% of the federal poverty level. And then we also have an Intro to CGM program, which provides 3 months of free education and access to a CGM for those who have not had reliable access to one before. I'm excited to say we're now available in 16 states with more coming very soon. And by very soon, I actually mean tomorrow. We're adding another 3 states. So that'll bring us up to 20 states and Washington, D.C. And we've helped almost 1,000 participants since January of 2024. It's really easy to get involved. Eligibility requirements are a diagnosis of type 1 diabetes. And note, this does not just mean newly diagnosed. We're here for you anywhere along your T1D journey. And yes, this does also include LADA. You must be 18 years old or older. You must speak English and or Spanish. You must be able to connect and participate in virtual care. So that means usually access to a smartphone or computer for Zoom video calls. And then you must have a primary care doctor or endocrinologist, or be willing for us to help you connect to one. And then you have to live in a state where we're licensed in. And we can't serve people who are currently pregnant. We can help with pre-pregnancy and post-pregnancy, but for those who are currently pregnant, we really believe that you need that in-person care. Again, that list of states is growing fast, and so the best way to take a look and see if you're in one of the states we serve is by taking a look at our website. That's always going to have the most updated and current list of states. And you can get started in just 3 easy steps. You can sign up on our website at bluecirclehealth.org. We'll contact you to create a care plan that meets your needs, and then you start your T1D care and support program. I'd like to play a short video from a few of the people who have gone through the program. It's about 3 minutes long, and while that's playing, go ahead and share any questions you might have in the chat, and I'm happy to stick around and answer them. I'll see you back in a second.
Explain it to people, I usually say,
living with type 1 diabetes is pretty burdensome,
complicated, it's really, really tough.
challenging, too many ups and downs.
I'm never not thinking about it.
I lose a lot of sleep, it's very emotional.
The only predictable thing about type 1 diabetes is that it's unpredictable.
It makes me feel really vulnerable and afraid, and I don't like feeling afraid and vulnerable with my diabetes.
My daughter was diagnosed when she was 3. If I couldn't afford for both of us to get supplies, and I'll just literally take the shirt off my back, take the insulin out of my body and put it to her.
Like, it's about every day, and insurance shouldn't be such a fight.
I literally spent days on the phone calling the provider, calling the pharmacist, calling the insurance, calling the pre-op company, and then calling all those people again to tell each other what the other one said.
It's like everyone's pointing their fingers at someone else. In the meantime, I'm watching my supplies dwindle away to nothing.
Like, that's a constant fear,
And so things that feel like a fundamental right are out of reach for many people.
It's just wrong.
A friend of mine on Instagram sent me Blue Circle Health, so I immediately signed up.
Blue Circle Health is a nonprofit with a free clinical care, education, and support program. We deliver our program entirely virtually. It's all telehealth, and it's up to 6 months long.
You get education, you get support, you get assistance navigating insurance. It's phenomenal.
I don't know where I would be right now if I didn't find Blue Circle Health. They picked me up when I was at one of my lowest points.
It's just honestly a godsend
felt like they get it. It felt like we're making the change that we should already have. We were really fortunate to have funding from the Helmsley Charitable Trust to make this possible and create this program and be able to offer it for free. My life has like drastically improved. I have really great insurance. The insurance counselor through Blue Circle was amazing. Not much makes me like that emotional, but like having to not worry about the financial aspect of that as a single mom who's like rebuilding is, yeah, it's really like comforting. Yeah, I'm crying.
And if Blue Circle Health can get out there and show people that this is the right way, it's the right thing to do. You don't have to go through it alone.
All right. Thanks so much for watching that. And again, please visit our website at bluecirclehealth.org to learn more and sign up. So thanks again for your attention today, and I hope to see you at a future event.